Hopefully you've still all got all the caffeine on board from the coffee earlier. And hopefully this isn't going to be anything you don't already know. And if you are a bit nervous about it, hopefully I'm going to dispel all of those rumours as well. So I'm going to give you a talk about what NMC revalidation is, talk about the revised code of conduct and the requirements for revalidation and how they differ from PrEP. And hopefully we can have any questions at all. I'll be able to answer them, or JP as well will be able to answer them. So what is NMC revalidation? It's going to be a way in which nurses are able to demonstrate to the Nurse and Midwifery Council, their regulator, that they continue to be fit to practice and to remain on the register. So in between the 3 years in between renewing your registration, you need to have met a range of requirements to show that you are fit to practice and remain on the register. And each month, the NMC are going to select a sample of nurses and midwives who've recently revalidated, just to make sure that the declarations they made are true. And it's going to be nothing new that hasn't, they're not going to ask for any additional evidence that you haven't already had to do in order to meet revalidation. It's just so that they can confirm that everything you've said is true. So what has the RCN done in order to help shape revalidation? Well, we've been involved with the NMC throughout the whole process, and we have had members, stakeholder groups. We've commented on the NMC's plans for revalidation through all their stages, and also we implemented in looking at the code of conduct as well, and also helped advising them on that. And the 4 countries have been involved in the whole process of revalidation, including those members that went through all the pilots. And the reason revalidation came about is because of the serious care failings at Mid-Staffs Hospital and the recommendations from the Francis report, which talked about the minimum standards that were needed for appraisal and the importance of professional development, and for each nurse to demonstrate up-to-date knowledge of nursing practice and its implementation, and also to demonstrate commitment and compassion and caring for patients. So for public, it's in order to protect patient safety, and for registrants, it's taking responsibility for their CPD and their fitness to practice, and also within the nursing profession to promote a culture where nurses value keeping up to date and challenging poor practice. There was lots of discussion as well that the RCN inputted in around the confirming role, and should it always be a nurse, and where is it that nurses are definitely going to input into this. And I think we all agree that as nurses we bring something unique to the table, and our work is different compared to that of other healthcare professionals. And so it's really welcome that nurses have been mandated to have this professional development discussion with another NMC registrant, because I think it's really important that that discussion happens with someone else who totally understands your practice and how you work and how you care for patients and work with each other. So you can see there the different pilot sites for which the revalidation happened during the spring and the summer of last year. And also the NMC evaluated these pilots with external companies like KPMG to see whether the NMC were ready for revalidation, and just sort of look at their cost-benefit analysis and lots of different economics. Hopefully you all had one of these drop through the post, and if you didn't, you can still access it online. So this is the new code, and everything around revalidation and how you revalidate is central to the code. And if you haven't had a chance to read it yet, I'd encourage all of you to read it and really get to know it, because it is going to be central into how you do your reflective pieces and your reflective discussion, how everything we do as nurses relates back to the code. And the code obviously contains the 4 Ps, which are prioritise people, practice effectively, preserve safety, and promote professionalism and trust. And this, as I said, this is the focus for all of your professional reflections. And you're encouraged to also, when you get your feedback, whether that's your patient feedback or colleague feedback, as well, to bring the code in when you're looking at that. So down to the nitty-gritty. What are the NMC Revalidation Requirements? So you must have done a minimum of 450 practice hours over 3 years. Obviously, get a lot of people that say, well, what happens if I'm dual qualified? What happens if I'm a children's nurse and an adult's nurse? It's only 450 hours. Or what happens if I'm a SCUFN, a public health nurse, and an adult nurse? Or what happens if I'm a nurse and a midwife? If you're a nurse and a midwife, you have to do 900 hours. Everything else, it's 450. So 35 hours of CPD, which, when you think about it over 3 years, really isn't that much. The difference is that 20 of those have to be participatory. Now, whether that is going to be in a workshop where you are interacting with other people, or whether it could be in certain kinds of meetings or in-house learning at work, but 20 of those have to be participatory. So the others could be online learning, you could be doing e-learning in a portfolio on your own, you could be using something, for example, in the Nursing Times, you have those articles and you can do your sort of CPD afterwards, you can reflect on the article, what have you learnt? And that would count as part of your CPD learning. Quite a few people have asked, well, does my mandatory training come into these hours? And I think what I would say back is that which parts of those, not all your mandatory training is clinical. Some of it isn't really relevant to your clinical practice as a nurse. And I would encourage you to find different things that would be involved in your CPD for that. Some of your mandatory training might be highly applicable and you could reflect on that and see what you've learnt and how all that applies to the code, but some of it will not be. And also I think I know and understand it's very difficult, can be very difficult for people to encourage their employers to get those hours in, that CPD in, to help them learn and progress in their field. And hopefully this will be a great platform with which to encourage employers to say, you know, I need my 35 hours of CPD and 20 of those have to be participatory and I need to go to this event in order to be able to progress my knowledge and to be able to interact with other people and learn. And often this bit, the 5 pieces of written reflections, is the bit that people get really nervous about. And some people, it might have been a long time since people were students, since they did their Gibbs or their John cycle, and some people love the cycles. They really enjoy having a framework and really getting into it and writing 8 pages. Some people, like me, do not like the cycles. And I think we reflect, as nurses, we reflect all the time in different ways, whether that is running home from work, thinking about your day at work, whether that is going to the pub after a shift with your colleagues and having a chat about your day over a bottle of wine, whether that's just doing it on your own or with others. We do it all the time. And it's about putting that on paper and taking it back to the code. I am, as I said, I'm not a framework or a cycle person. For me, it's the way I reflect is very simple. It's what happened? What is it that's the problem or the good thing or the thing I'm interested in? So what? So what? So what does this mean to me as a nurse? What does it mean to me in my practice? What is it that's new? What information have I got that's new? And what does this mean in my practice now? And then what now? What does this mean going forward? What new things have I learned and how do these reflect to the code? So what now? That's personally how I do it because I find that the easiest way. But for those of you that really love a framework, as you will remember from nursing student days, or if you have done it now, then you can use that to help structure your reflective pieces. Just that now you need to write them down and associate them with the 4 Ps in the code. Some of you might think, oh, this may be quite difficult. Once you start doing it, it's incredibly easy how many elements of the code can come into that reflective piece. You can just weave all of them in. The pieces I've done, I've thought, oh, maybe this bit or maybe that bit. And then when you get going, you realise that you can pull bits from it all over the place, and that the code is a very, very easy to weave into your reflections and is really, really helpful as a framework. Then you also have to have indemnity arrangements in place. So if you are employed full-time, that would be covered by vicarious liability. And if you are working on your own, or you're working as a self-employed practitioner, it's to confirm that you do have that indemnity in place, whether that's through the Royal College of Nursing or through another provider. And then your good health and character. And obtaining confirmation from an appropriate person. So this confirmation part is somebody saying that you have met the requirements as laid down by the Nursing Midwifery Council. So that it's that you've met all those things on the board above. It's not that they're saying that you are an excellent practitioner or a terrible practitioner. They are saying that you have demonstrated what the regulator has asked of you. So it's that you've done all of those things on the board. That is what the confirmer is confirming. And I know that there's quite a few people, if you don't work in clinical practice, perhaps you're a manager, there are people that are worried about getting this feedback. So it would be great if you worked in clinical practice and you could get patient feedback, but there's so many other ways. You can get feedbacks from your colleague if you work in a very multi-professional environment. You can, if you have had perhaps if you're at a senior level and you've had a recent CQC inspection, there could be some feedback that has come out from that you can use. And I think it's making people think a lot more about, if you are a manager or a leader, about when people have done things well or not so well, perhaps communicating that with them by email or however, to say that they have done a good job, or maybe there are things that are coming out of people's appraisals that they could use. And it's great to be able to reflect on the good things, on the good patient feedback, the good staff feedback. And perhaps it's those conversations that have been a little bit harder. So maybe conversations you've had with a relative that have been difficult. And I think those are the ones that provide you with the richest information that you can use in order to reflect on and to be able to build that into the code. So while they might be a little bit trickier to do, those are the ones that you will probably learn the most from. There is the NMC provided a set of templates for which to record your reflections, and you can do them however you wish, but I would encourage you to use that template, because were you asked to submit your portfolio to the NMC, they'll want to see it on those templates. It's very easy to set out, and there is no prescribed way of doing it. If you're the kind of person that likes brevity and writes very concisely and you'd like to do your reflection in bullet points, there's no reason why you can't do that. If you want to write 8 pages of essay because you've really got into it and you love writing, then that's also okay. The form is electronic, it expands to enable you to write forever. So this is just showing you what's different from PrEP. And as you can see from the board, there's very little that's different. So although it's obviously this is now a much more formal process, it's things that we should have been doing already. So it's nothing really that new or nothing scary. So again, this is just from the NMC website, just to show you, just in a different format really, of all the different things that you need to be able to do to revalidate with the Nursing Midwifery Council. I get quite a lot of questions about people in terms of portfolios. What do I need to use a certain portfolio? What do I do? And there are a lot of portfolios out there on offer. You've probably seen, sign up with us for £100 a year and you can put all your revalidation stuff in one place. And if you are the kind of person that likes to be very, very organised and likes to have separate folders and perhaps would be better if someone else was driving that, then that's absolutely fine. But you can also create your own folder on your own desktop and just drop things in. It's as long as if it's electronic, that's great. If you're someone that hates technology and really doesn't like a computer, you can handwrite it all. But when you submit it to the NMC, you'll just have to find a scanner to make sure it can then be collated into an electronic folder. So I would encourage you to do it electronically first off, because it's just easier. But if that really upsets you, you can do it on paper. And just a few considerations really relevant to cardiothoracic practice, because obviously there's a lot of emphasis for you around multidisciplinary working, and to ensure that you deliver the best care possible for patients. And so you're in an environment where you'll be able to get that 360-degree feedback, to be able to use varying feedback to help put into your revalidation process to help you reflect. And JP's talked about advanced practice and new ways of working, new technology coming in, and also new training and ways for you to expand your practice and make sure your knowledge is up to date. And I've also said about those people who don't do clinical activity, who are managers or leaders, and about the different ways that you can still revalidate. It doesn't have to be based purely on clinical. It can be what you do in your job and how your nursing background and what it is that makes you a nurse makes you what you do in your current job, and how you can reflect on the things that you do that are relevant to nurses and nursing and use the code. So, as I've said, make sure you're familiar with the new Code of Conduct. I hope by now lots of you have signed up to NMC online. It's very easy to do. You just create yourself an account, and it will show you on there, once you've logged in and created your account, it will show you when you're next due to pay your annual fee and when you are due to revalidate. And when you come up to revalidation, they start sending you emails to let you know that it's nearly time for you to revalidate. And those emails will keep prompting you to make sure that you've got everything in place. And I think for those people that are revalidating soon, so the next set of people start in April. So there might be some of you that are here maybe at April, and some of you who are September. I think it will be more acceptable, say, for you to have your reflections that maybe cover a shorter span of time. So you might have got all of your reflections done in the last 3 months and all of your written reflections down on paper. But I think if, like me, you're due to revalidate in 2018, my reflections need to be spanned over a period of time to show that this is a continuous and a developing part of my practice. So they're going to have to span the last 3 years. And I've talked about identifying the range of different learning opportunities that are available for you. These could be, you could be engaged in a Twitter chat. If you're really into social media, you could be using Twitter as a way of getting in your participatory learning and Twitter events and just utilising the knowledge that you're sharing amongst people in that kind of forum to inform your practice. I've mentioned started to collect your evidence. I think probably most of us in the room will have, I certainly have a folder in which mainly certificates were thrown. I think it's kind of under the television, this burgeoning folder of stuff where things just go in it and you'll be like, I'll sort that out, I'll put that all nicely ordered. Well, now is the time to start thinking about that and getting everything in order and trying to get it electronic. So you need to identify who it is that you would like to have your professional discussion with. So that needs to be another NMC registrant. And it might be that your line manager is the perfect person. You get on very well and they completely understand the role that you do and will be the perfect person to have that reflective discussion with. If you are somebody that works in a different environment and your line manager is not a nurse, or you don't get on with your line manager for any reason, you need to identify another NMC registrant for which to have your discussion with. You could have your reflective discussion at the same time as you have your appraisal. It depends how much time you've got set aside, because these are two separate things. They're not the same thing that you can mesh together. And I would suggest that you have that, you identify who it is that you want to have your discussion with, and you pinpoint and set aside time for that. And that it is a little way before you are due to revalidate. So just in case you have your reflective discussion and that person maybe says, oh, I think maybe you should go away and think about this reflective piece a little more, you've got that kind of space and time built in that if there do need to be any adjustments or any things that you need to think about or another reflection that you need to do, that time is in there and you're not scrabbling at the last minute. And in terms of the confirmer, there's a list on the NMC website which tells you who the confirmer can be. It can be, I mean, ideally, if it could be the same person. It could be the same person that you've had your reflective discussion with, and they could sign you off as your confirmer. But if that's not possible, then there is a list of people with whom it can be. One of those can be a doctor. And as I've said, they are signing to say that you have met the requirements that the NMC have asked of you. So they're not signing to say anything else. They're signing to say, yes, I've seen the written pieces of reflection and the hours, and I know that they've had their feedback discussion with their line manager. That is what they are signing to see. There's a lot of information around there. The NMC website is very good. There's a whole revalidation website with all of the templates, with examples, with videos to show you how it is that you can revalidate, how you can meet those requirements. And also the nursing and midwifery, the RCN also have a lot of revalidation materials available as well. I have a few little pocket-sized revalidation guides here, but very, very few because we've run out. But all that information, including those guides, are all available on the RCN website. And also there is feedback as well from RCN Direct and advice on there. And as JP said before, if there is anything that you're unsure about or you want advice, then you can always ring RCN Direct as well.